Welcome to another episode of Late Nights with Dr. G. You have questions, I have answers. Well, on this episode, we're going to focus on kind of the nitty-gritty when we're talking about longevity and all of the new and improved type of treatments that we have for aging, any type of decline, anything that's going to help you live better, stronger, and longer. So we're going to get down into that and really kind of get into the science a little bit more and to kind of find out what's really working, what really doesn't, and what you can and cannot do according to the FDA. Hey guys, I'm Dr. George Armandaris.
I should have brought my Zen pouches because those are actually nicotine pouches.
No, I know.
Let's start off with, since we're talking about, longevity, what helps, what doesn't. I read a study recently about 1 milligram of nicotine is actually useful in terms of helping your brain health. It said something about like helping prevent Alzheimer's. Did you ever read about that?
This is the thing. Pretty much in every cell of our body, we have nicotinic and muscarinic receptors. Okay, these receptors, they're stimulated. Acetylcholine's another receptor, and it's very, very critical for just physiology and living and cellular actions. Okay, and so muscarinic and nicotinic obviously are super important because it's essentially in almost every cell, if not every cell. That being said, when you're taking nicotine, that's why cigarettes are so damn addicting, because you have a receptor pretty much in every cell of your body that nicotine is going to hit onto. Now, but the problem with, you just don't have nicotine in cigarettes. You got 141, 142 other things in there that are questionable. We don't even all know. But now then you get into that, you get into the vaping, and everything is negative there. Okay, because at least you have a filter with cigarettes. But that being said, Zen, I've tried Zen, and I know exactly what you mean. They take that for focus. It stimulates certain receptors, those nicotinic receptors in your brain to help you to focus, to concentrate. And there are primitive studies or initial studies. I don't even know if there's a true phase 1 study that have tested what nicotine does specifically. Now, obviously, there's phase 1 studies with nicotine because that's a very well-studied receptor and medication, I guess you would say. But what it does specifically can help with cognitive learning, can help with cognitive therapies. So can it help anybody that's had, like, say, a stroke, Alzheimer's, things of that nature? Absolutely. It really can. I've tried them. They made me so dizzy and nauseous, I had to spit them out in like 10 minutes.
Yeah.
That's just because I don't smoke. And a lot of my friends in college, they used to dip. And tried that, got the same feeling, got sick, wasn't good. So if you're used to that and you have to build up a kind of a tolerance, if done correctly, and I can't say what's correct or non-correct because some people take it and they do very, very well with it. In fact, Zen, there was a Norwegian guy that I think he was part of the company that's for Zen, okay, and has done very, very well. But a vast majority of those people from that country utilize Zen because he was one of the guys that started.
They're always from Sweden.
Yeah, I know, right? And so it was pretty cool because he was able to show on some, and I don't know, like I said, I'm not as familiar with those type of studies, but I know that they did do studies, controlled type studies, that I don't know how random they were or anything like that, but people did really, really well in dealing with focus and attention and things of that nature. So is it a positive thing? I think it can be. It definitely can be. You just have to kind of watch with the addictive potential of nicotine. I mean, it's the same thing. It's just probably a little healthier for you because you're not smoking, something with other stuff in it besides nicotine. And so you have to kind of be careful with that. Nicotine is awesome and it really helps you, but too much nicotine can cause a lot of other things. Obviously your blood pressure can go up, heart rate can go up. It can cause vasoconstriction in your vessels. And if you're older, you could have peripheral vascular disease. It can lead to heart disease. I mean, there's a lot of things that can happen if you do it too much.
Yeah.
But that's the old adage,
Anything in moderation.
Everything in moderation is probably okay for you within reason, but anything even water. I can keep drinking a lot of water. If I drink too much water, it's going to lower my dilute my sodium, and I could have cerebral swelling. And I could get water intoxication. So everything in moderation. But yeah, I do think, and like I said, I don't know a lot about that. I know about what nicotine does and the receptors we have. That in particular, the Zen, I just, kind of recently heard about that, and I tried it, and I was like, okay, I'm getting dizzy here and getting a little nauseous. I better stop doing this.
Maybe like too many milligrams, sir.
Well, I took the lowest amount they had,
the 3 milligram.
But I can see how you do focus. But I was just focused on not throwing up because I started getting dizzy.
Yeah.
I started getting real. I was like, holy moly! It's like when I dipped for the first time, and that wasn't a good situation either.
Moving on from that, we're obviously on the topic of longevity, on the topic of peptides.
Yep.
I want to go a little bit deeper learn a little bit more about the deep science behind it. Can you just tell me a little bit more about your understanding of peptides, all of these kind of, health gurus that talk about, you've mentioned a couple of names. We talked about like semaglutide, stuff like that. What is it that you specifically like about peptides, and what is it that you have learned about them over time?
Well, first and foremost, a lot of times you see a lot of these influencers and these guys that, some of them are doctors, most of them are like chiropractors. You don't see too many doctors, true MD or DO doctors, medical doctors that are pushing this. Now, not to say they shouldn't, they really should, because they can give a more accurate description of what it can do to a patient. Because when you see a chiropractor who's real buff and everything talking about them, they know the science. They'll get in there and show you the pathways and all this stuff, which people really don't care about. But it's good to know that, especially since they're a chiropractor. A lot of them have backgrounds in nutrition and things of that nature. And obviously, we get like 2 hours of nutrition in medical school, and that's about it. Okay.
Yeah.
And so we're definitely not nutritionists. And obviously we talked previously on episodes that food is medicine, and we should know nutrition a lot better than we do. And so what I think about peptides, one, I think peptides are going to change the way we treat patients. And I say that for doctors that are actually treating patients. And I'm not talking about, and I'm hitting on chiros. I don't think anything wrong. Hey, they're good businessmen for the most part, but you have to kind of think about when you tell somebody, hey, these peptides are great. These are awesome. Yes and no. Yeah, they have a lot of good benefits, but there are negatives to these peptides, mainly because they haven't been studied. And so people have had issues with them. Now, granted, it's anecdotal in the sense that there's not a lot of true research out there. The most researched peptides, if you can, and they are peptides, are your GIPs and your GLPs. You're talking your semaglutide, tirzepatide, things of that nature. Okay, everybody Wegovy and Ozempic and what is that, Mounjaro? All of those brand names, they're great. They have helped a lot of people. I think some patients said, hey, wait, if I just got 10 or 15 pounds, I'm going to use this, to get down. But, it wasn't necessarily a good thing. They may have received those from their doctor. But I think that early on, you saw these wealthy people or these famous people kind of pushing that. And if they say, oh, no, I just diet and exercise. Hey, you can lie to a lot of people. You can't lie to me, okay? And you probably can't lie to your doctor either. And we pretty much know when people are using it or not using it. And it's mainly because of the side effects of what it does to your skin. You can really tell. Makeup can cover that, but only so much. And so I think that peptides for longevity, it's a growing type of science that's getting better and better. We're utilizing it more and more. Patients are utilizing it. They have to understand that there's not that much research behind it. There are some studies that have been, like I said, the GLP and GIP, those particular peptides.
So how are they classified though? Because you say typically there would be like a classification for a type of drug or a type of, all of them have particular parts of the body they help, and muscle recovery, digestive. How do they classify peptides? We keep hearing the word peptide. What does that really mean, right?
A peptide is an amino acid. An amino acid tells your body to do something, okay? L-arginine, which helps for growth hormone in your body, that's an amino acid that you're able, and you can take arginine, okay? And people like to take arginine because it increases their human growth hormone. It really doesn't increase human growth hormone, but it's a precursor to nitric oxide, which we all need, in our body. There's a lot of those type of things. These are just more specific, smaller subunits that can kind of tell your body what to do.
How do they derive them, though?
It's a standard amino acid because it's considered a supplement. Now, granted, Eli Lilly, they're the ones, the makers of semaglutide, okay? And so anytime there is a new drug that's, let's say, they manipulated it more, if it's minimally manipulated, that's considered a 361 by the FDA. And so that means that you can use that. It doesn't have to go through the process of, it can be approved or disapproved, but it doesn't have to be FDA cleared in the sense that, it's safe, but safety is, there's still a question mark. It's not like a drug. It's not a biologic where you go 351. That particular code says that that's a drug, okay? And that goes through all of these different trials. It costs about anywhere from $10 million to $1 billion to make it. But obviously, Eli Lilly has made a lot of money from these particular GLPs, okay? And GLP stands for glucagon-like peptide. And glucagon is, and I explained it before, insulin has to be low if glucagon is high. So if your receptor is hitting on that glucagon is high, it's gonna be difficult for your insulin to go up. Insulin doesn't bring your blood sugar down. That's more of an indirect action. What insulin does, it blocks any other form of energy to be utilized. So if your insulin is high, then fat that you have floating around, your body goes, oh, well, I can't use it. I'm going to just store it. And so people just get bigger and bigger with insulin resistance, and you get type 2 diabetes, okay? Or you become morbidly obese. That's a problem, okay? So these peptides, of all the peptides, you hear this BP151, MOTC, CJC, ipamorelin, all great treatments, but they're more considered a supplement right now. And because so many people are taking them and they're pushing them so hard, the FDA, they're trying to make some hindrance on that. It's very difficult because they're really not considered a drug, a biologic, okay? Because they're minimally manipulated.
When you say minimally manipulated,
I know it's a tongue twister.
So what does that really not just mean, but like what are they pulling these from? Like, are they pulling is collagen considered a peptide? I mean, no.
Collagen is usually a part of a tissue. And a lot of times, let me tell you about BPC 157. You know where they get that from?
You said cow stomach, right?
No, dogs. Dog stomach. It's an acid. It's in the acid. Okay.
Oh my gosh.
And you're like, what? Yeah, that's crazy. But now they get it originally. The original is from that. They chemically formulate it through raw materials and make it synthetic. It's considered synthetic, but it's minimally manipulated. They're not adding a whole bunch of different things to it. Now, Eli Lilly had to manipulate more the GLPs, because right now you can get any compounding pharmacy can make semaglutide or tirzepatide and stuff like that. They can do that. You can make it. It's not that hard to do. Everybody has the ability to do that if you have
a license,
proper.
Right?
Yeah, you have to have a license. You have to have proper lab, 503B, and all this. These are just these numbers that you hear people. These are numbers that are utilized for lab certifications and to make sure that lab has met some criteria, usually FDA criteria, but also with the biologics and human tissue type certifications, and sterility processes. But so for longevity, if you're really thinking about that, we have to talk about which peptides are the ones that are going to, which ones have been studied, and then what can we use. Now, I brought up BP 157. I love that drug. I've used it myself. I've used it on patients. Now, everything's all about informed consent. Informed consent meaning I informed them. Look, the FDA, this isn't an FDA approved. In fact, the FDA doesn't really, if you're only using it for basic things, like let's say you have a bad knee or a bad shoulder, if I'm using it because I'm a pain management doctor and injecting it sub-Q or in there, they're not really going to do that. But if I get in there and say, oh, you got arthritis, you got it torn, this is gonna repair that. Regardless if it does or doesn't, there's no studies that says that it does. And so they're gonna come back and get me. They'll find me, or God forbid that take my license away if I keep doing it, And so I can't make those claims. And so a lot of people have made claims that, stem cells, he'll treat this, he'll cure that. I've even said, yeah, because there have been situations where stem cells injected into a spinal cord has caused rejuvenation and regeneration of tissue that has caused these people to not be paralyzed or not full paralysis. It's gotten better is my point.
Yeah.
And so that's great, but there hasn't been a study showing that these are consistently, you can reproduce these in a proper study that's a randomized, controlled, placebo-affected study, and when you don't have that, you just can't say those things.
Right.
Do I think they're great? I think they're awesome. I think the future of medicine is going to be based on gene therapy, and we're just touching the tip of the iceberg right now on gene therapy. Peptides are going to be another, because peptides are minimally manipulated, and you can produce those rather easily without a crazy cost. And they're going to be seen. I think eventually they're going to some way, somehow try to
charge more for them.
Well, charge more for them and not allow us to use it. Like any supplement, the bad thing about supplements, because the FDA they can't control that per se. You see people say, oh yeah, that's FDA cleared or FDA approved. Well, it's cleared by the FDA. They didn't approve anything. They don't approve it unless they say it, and usually that's going to be with a drug. Yeah. And that's after usually 10 years of research and a lot of money. And so nothing is FDA approved. It might be cleared in the sense that they said you can use it, but they're not going to say that this is approved and you're good to go, because they can't guarantee that.
Yeah.
Okay. That's where all the studies come into play. And so research is critical for all this. As physicians, I do think that we are the ones that should be giving this out. Now, you have a ton of med spas that give it. They give a ton of chiropractic clinics that give it. I'm not here to say they should or shouldn't do that. I just think as a physician, we should give those, because although there's not a lot of side effects if given properly, and those people know what they're doing. Don't get me wrong. I don't think they just are giving it haphazardly. But if there's a side effect, they're like, hey, I told you. Their hands are up. And then what happens with the patient? The patient has to go to the emergency room, or now the patient has to come to their doctor. I got this. Well, what'd you do? Well, I took this peptide.
Is there situations that you've heard of that have been like that?
Well, this is the thing. There's a $2 billion lawsuit on Eli Lilly for Ozempic. Now, if something is a brand name and they're making billions of dollars on it, you can guarantee the lawyers are going to be like, because they're out of all these, millions of people that are taking these drugs, there's going to be some side effects. Yeah. There's going to be some negative side effects. And so some of the side effects are going to be diastasis of the colon or the digestive system, the digestive tract. And then you get obstructions, colonic obstructions or intestinal obstructions. You have profound nausea and vomiting in some people. Okay. You have people going blind. There is a what is it called? It's a retinal hypertrophy in the eye that's non-vascular in origin, and they're finding out with more treatment, and with a lot of the patients that are coming in, they're going blind from semaglutide, or Ozempic, specifically Ozempic. So obviously, there's a big lawsuit with that. Now, what's going to happen is people are going to settle out of court, and they're just going to pay that because they've made. If it's $2 billion, they're not going to have to pay $2 billion, but they've made $10 billion. From it, and so who's to say all that? But my point is, there are side effects, and these people need to think about that. Now, the most studied or most researched peptides are going to be your GLPs. Those are the ones they've had. There's a MACE study that's it's a cardiac adverse event type of study. They call it the MACE study, and what that does is to see if it's lowered it or has increased it. And everybody on GLPs, it has lowered. Now, tirzepatide and semaglutide are the ones that mostly have been studied, and those have shown that it is better for patients cardiovascularly, and it can actually help. Well, when you lose weight, you're not eating a bunch of food and you're not, the cool thing also about GLPs is it causes you cognitively, it causes you to not kind of crave things. Yeah. Let's say if you're a alcoholic or if you like sugar, and I mean, obviously it hits on sugar, but pretty much anything, gambler, you're going to get to a point to where you're just like, I just don't feel like doing that, so it's going to be better for you. So obviously cardiac events have gone down. These people have lost weight. They're eating better. They feel better. They sleep better. They might even start working out a little bit more. Obviously, cardiac events are going to go down. Then they check frailty. Frailty is a big one. Now, most of stem cell research has shown that. Stem cell being autologous, meaning it's bone marrow or fat from you. I take your cells out, then give it back to you in your shoulders or your knee or even IV. I've done that as a pain management doctor with bone marrow aspirate, and 100% of the patients. But it wasn't a study, but I treated probably 150 patients. 150 patients got better. I mean, it was awesome. I mean, every single one of them. In my eyes, I'm like, it's safe. One, I'm extracting your bone marrow and I'm putting it back to you.
Yeah.
And it's minimally manipulated because I took it out of your iliac crest and I have fresh bone marrow blood, flipped you around, used a scope into the knee and pushed it right in there I didn't put it.
Is that direct?
Yep.
It's just,
and I didn't put it, minimize it. I didn't do anything. Now fat you have to minimize, but that's just blood. Now you can only put so much because I put 10 cc's in your knee, you're going to stream. It's going to hurt because that's too much pressure in your knee. But around something like 3, 4, so maybe even 5 cc's depending on the size of the patient. And every single one of those patients, it took about 3 to 6 months, but every one of those patients got better.
is that like basically, let's say they have this issue, it's probably caused from some sort of stress, right?
Whatever. It could be a arthritic stress. Like I did that in every one of my patients. Now, some of them had torn meniscus. Some of them had decreased cartilage. Some of them had ACL tears, PCL tears. Some of them had just good old-fashioned osteoarthritis. Some of them had rheumatoid arthritis. Given that direct injection there, all of them got better. Now, that's not a true study, though. That's just an anecdotal. I did it. There was no placebo or no control group. I just did it, see what happened. And they knew about this. I'm like, it could really help you or it could do nothing for you.
You're just taking their own blood, but all you're doing is essentially just giving them blood where they might not have as much blood flow.
But it's not blood. There's 2 places where you can get your stem cells.
Yeah.
Okay. It's going to be your bone marrow and it's going to be your fat. Okay. If I were just to put regular blood, I can spin it and make up PRP, platelet-rich plasma, but that's mostly growth factors. There might be a handful of stem cells in there, but they really aren't doing anything. It's mostly the growth factors that can help your immune system to clear out and maybe clean out some of those things or make them better. The stem cells, and look, when I'm only putting 4, 6, 8 cc's, let's say it's closer to 6 cc's of pure bone marrow blood, it's only going to have anywhere from 20 to 50,000 stem cells, which is not that much. And when you're talking about stem cells, if 1 million's good, 10 million's a whole lot better. Okay. When you're doing more specific stuff where, you have to be very careful with where you're injecting them, most of the time in joints, not so much. If it's autologous, that means it comes from you. The FDA doesn't have a problem with that.
Yeah.
Okay. What they have a problem with is if you amniotic. It's not from me. It's from somebody else. Okay. Have I used amniotic on patients? Absolutely, I have. Because either they wanted to try that, they had informed consent, they knew, the side effects, which were questionable because there's not that much studies on them, so we don't know all the side effects. But one of the things, somebody have active cancer or they just recently been treated for cancer, even if it's in remission or it's gotten better or they had surgery and they don't have it anymore, I wouldn't treat them with stem cells, any type of stem cells, even if it was their own stem cells. I don't feel comfortable with that. Some doctors do, and that's fine. That's their prerogative to do that, as long as the patient has informed consent. That's what's critical. And I think that these other places, when you see a med spa or a chiropractic clinic or whoever that are not medical doctors, true physicians that are treating these patients, I don't know how, obviously they get consent. But if it's a true informed consent, that patients understand the risks and the benefits, everybody understands the benefits, but do you understand the risks? And so that's where it's really critical for when you're picking somebody, And trust me, I go on TikTok or Instagram, and there's these guys know about peptides a lot better than I do. But the real aspect of it is that they're still not a physician. And although they've utilized it in their body and they've done really well, they're one person.
Yeah.
And they may have done it to their friend.
And
their friend's doing great.
It's not one size fits all.
It's not one size fits all. And they don't, you're telling the general public, hey man, these peptides help me. And this is what it does. It helps in, increasing your mitochondrial cellular respiration and to help give you more energy, or it, repairs you like in BP 157. It's awesome. And like I said, I've used those. But what happens if they do have a side effect? Because I know what I would do, because I can treat my patient if they have a side effect. A chiro or some med spa, what are they going to do? They're going to tell you, well, you're going to go see your doctor.
Yeah.
What? Exactly. I can't help you. You're going to have to go see your doctor. And they're like,
you have to go see Dr.G.
But you gave it to me. Yeah, my hands are, I don't know.
That's a really good point.
And so you got to think about that. And that's what kind of irritates me, that there's not more doctors, because, man, I've met some a whole lot smarter than me. And it's just awesome listening to some of these doctors. Now, they're more research-based. But some of them are clinicians where they actually treat patients. But you're not going to see those guys on TikTok, and you're not going to see those guys on Instagram. And unfortunately, I wish we could see those, because those give you more accurate. Now, there are some, don't get me wrong, you can go on, there are some doctors on there that are great. Most of them are more, they deal with cancer and things of that nature. And a lot of it's showing, bottom line, how natural or naturopathic type treatments are beneficial, along with some type of chemotherapy or gene therapy. You say, hey, look, you take a heavy dose of IV vitamin C and fast and do red light and, get sunlight and, don't take that chemotherapy. You cannot tell somebody that, because chemotherapy has been proven to help people with certain cancers. And so I would never say that. Now, if I got a cancer, I would think twice about doing chemotherapy, but I guarantee I probably would do it along with these other alternatives like fasting and things of that nature. We need to focus on how we can make our immune system stronger and better. Everything. And I'm talking, I don't care what clinical issue you have. If you have problems with your heart, you have problems with your kidneys, you have problems with your joints, you have issues going on. I don't care what it is. If you have a strong immune system, you're going to be able to fight that. Your immune system fights cancer multiple times a day, every single day of your life. Just sometimes if your immune system's down, it misses one and it starts getting bigger and it grows into a cancer of some sort, And so our critical thinking should be based on immunotherapy and stabilizing and strengthening our immune system. Now, most chemotherapies, as an example, and I'm bringing up chemotherapy because it's just, people understand that. What does it do? Chemotherapy knocks out your immune system. Okay. Now it kills the cancer, but it also kills a lot of these good cells too. So there has to be a happy medium in between it. And I'm not saying I'm an oncologist, and I'm not saying don't use those. Trust me, if I had lung cancer, I'm going to be using those. You see them on TV, Invalid or Imblibid, or I don't even know the names of some of those cancer pharmaceuticals, but they have helped. So they've helped some patients. And damn it, if I'm dying of lung cancer, probably going to try some of those too. But I will still optimally do fasting, try some naturopathic ways, try different things to stimulate or strengthen my immune system so that I can try a drug like that that's going to give me a hit on my immune system, but will also kill that cancer as much, or bring it down to a point where I can have surgery or whatever, So that's my issue when people go, a naturopathic doctor. And I'm not, like I said, some of these guys they're bright. They know a lot, but they don't know what they don't know. Yeah. And they didn't go to medical school. You can call naturopathic school medical school. It's not medical school. You didn't do a residency. You didn't do an internship, And so those things I'm critical on. You can't just tell people, oh no, you shouldn't do that. You shouldn't do that. And maybe if we have better research and better knowledge base, maybe we can treat more patients on a more natural basis than utilizing these type of drugs. But we're not there yet. And we've shown, they've done countless years of research. Some of these drugs, or a lot of these drugs, do work under certain conditions. And sometimes they don't. But at least they have the research. And everything should be based on some type of research. You give the patient informed consent. You make sure that they at least they have all the information they need to make an educated decision in their health. Okay. But I also believe this. People need to get off their ass and start taking care of themselves. We talk about doing a parasitic cleanse. We talk about, getting sunlight, taking different peptides that help strengthen, make you stronger or whatever, Yeah, you need to do that. There's, when we're talking about longevity and up and coming type of research or things that are coming up that can help us, we have Mu cells. Mu cells is a type of stem cell that you can get. You can get it from bone marrow, but you can also get it from regular blood. Now, the system, there are a handful of companies that they have it has to be done in a lab where they can get those cells and culture them, and you can utilize those cells. Mu cells, M-U-S-E, Mu cells, they're multi-lineage. It's a multi-lineage stem cell that has the strength to not die right away. Mesenchymal MSCs, mesenchymal stem cells, you use them immediately, but they pretty much die off pretty quick.
It's like the half-life, right?
Yeah, it's very, very fast. You're talking hours to days in a few days. Mu cells can last 6 months, maybe even longer, but they can also cross the blood-brain barrier. They also don't cause tumors like you can give this to somebody and in hopes that even if they have cancer or they have recently had cancer, you can still give them Mu cells because they don't cause cancer. Now, would I still do that? No. I'd wait until they're totally cleared, 6 months to a year and so forth. That being said, you can, and they've actually been studied. And the stress enhance, the S and the stress enhance. That's what it is. I was like, what is that? So
what's the full one then? It's
multi-lineage stress enhanced cells, MUSE. And multi-lineage meaning it can turn into, you have 3 germ layers in your body for all your cells, your tissues, your skeletal tissue, your bones. And you probably remember this when in high school, ectoderm, endoderm, mesoderm. Okay. These are all the germ cell layers. It can turn into or repair any of those levels, whereas mesenchymals can't do that. It's also pluripotent. It can turn into anything, literally turn into any other cells. There's been studies that have shown on these severe skin disorders that it can turn into different layers in repair of these cells. I mean, it's crazy. And then
these are a type of stem cell.
Mm-hmm. Yeah, but I can get it from your blood. Let's say I can draw 20 or 30 cc's of blood, and then they can extrapolate it. They're not cheap. I'll give you an example. I can get Muse stem cells. There's I can count on one hand how many people can that make them in the United States. Okay, so you can't just call up Platinum Biologics or one of these biologic and to say, hey, let me get some Muse cells. They don't have them, but one vial might cost $5,000, $6,000, $7,000. Just one vial.
How many vials do you need?
Depending on what your issue is, probably going to need more than one, and that's my cost. I haven't even added in my how much I charge. You know what I'm saying? And so not that I charge a lot because a lot of this stuff, it's just an IV, just a little IV in there. Yeah. So it's not that I'm going to, I would only charge more if I said, okay, let's do this in your shoulder or let's do it in an epidural space because it crosses the blood-brain barrier. And so it's been studied already. They don't have great studies.
What's the use case? Like, what's the best use case for that?
Stroke. MIs, they've grown new heart cells, person that has stroke that caused new brain growth, new neuron growth. I mean, it's amazing. It's done some crazy stuff.
So here's the thing. It's experimental, but there's also a limit in terms of like who can afford it.
Yeah.
Now, it's not covered by insurance.
Oh.
But
none of the stuff that we're talking about is covered by insurance.
What happens if somebody has enough money, wants to get them? Is it not more popular because people just don't know about it?
Yeah. People don't know about it because let me tell you something. If more people knew about what it did, they'd be like, where can I get these? Where can I get these? But like I said, it's going to cost you 10, 15, 20 grand. On the low side, probably under 10.
You get it from your own body? Like they
No, what would happen is you can get these cells already cleaned and already.
Where do they pull them from?
You can have any, they're not donor specific. I can pull from you, treat them, grow them, and I can use those new cells. It doesn't have to be, what that means, it will not invoke an immune response. So I can inject them and nothing's going to happen.
I mean, is this like kind of like the equivalent of like colostrum protein in a cow? Like it's like the highest quality.
It is. It's the highest quality of stem cells. I think you're going to hear, just remember Muse cells because you're going to hear more about it. You know, go on ChatGPT or
the next few,
and just ask it what it is.
This is the up and coming thing right now. Then
yeah, and there's a few places to get it. I mean, our lovely Kim K. She went on and with one of the doctors and she got some of that. Granted, that was done in Mexico.
What was it for though? Like what would you do it in a cosmetic?
It's longevity. So if you have any issues, the beauty behind it, like if I give you an IV of mesenchymal stem cells, a majority of them are going to get locked what's called the pulmonary first pass effect because anything in your IV goes to your lungs first. Okay. And through the vessels of your lungs, and it goes through your lungs, and then you use it, whatever. But if you're talking about stem cells, it gets trapped in there. So during COVID, a lot of times they were getting bone marrow blood and using those stem cells from a patient and re-injecting it. Where does it sit? It sits right in the lungs. They got better. Immediately got better. Okay. But it was their own stem cells. Okay. And these people were dying. So you had nothing to lose. Okay. But everybody got better that had that done. Not everybody had it done, but plasma has a lot of these growth factors in there. Those people got better too. Now there's a lot of issues because they stopped having us use plasma, but I'm not going to get into that. You know what I'm talking about. And so anyway, everybody got better utilizing those bone marrow stem cells. Okay. And so these are just stronger stem cells that can last longer and can cross the blood-brain barrier, meaning if these cells hit on a particular antigen that it's an inflammatory antigen. And so they seek it out. That's what's amazing about it. Mesenchymal cells, it'll only go where your blood takes it.
So they're homing missiles.
And that's exactly, if you look, when you put it on ChatGPT, it will call it a homing signal. That's exactly what they call it. It finds inflammation in your body and it repairs it.
So you don't even need to have like extreme problems. You could just be somebody who wants to be healthier.
Longevity.
Just take it.
Yeah. And these wealthier people can do that, but there's just not that much.
They're not even educated on it, I'm sure.
No, some of them, I mean, they tell them and they're like, shit, okay, any side effects? Well, not that we know of. That's the whole thing. That's the worry about stem cells because you don't know. Well, can it? Now, granted, Muse cells have been studied that they don't cause tumors. They're not tumorgenic, or tumorgenicity, whereas mesenchymal stem cells are. They can cause a tumor. That's why you don't give stem cells to patients that have had cancer or recently had cancer. Even if they don't have cancer anymore, you don't want to give it to
high risk.
It's too high risk. And sometimes you have to wait, maybe a year, but usually probably 5 years without having any cancer. And so you have to be very careful with that. Now, if you're injecting, I'm talking more IV. If you're injecting in a shoulder or a knee, you have a little bit more latitude with, because it's going to stay there. They're not going to be traveling all over the place. It doesn't go systemic. Okay. But you have to think about that. And that's why I don't think people that are not physicians, I don't think they think that way. They're like, hey, I know this can help. And, 9 times out of 10, it can help. But what if they're the one person that it doesn't help and it causes more problems? What are you going to do? You go back to that person. Hey, this is going on. Oh, you need to go see your doctor. I don't know what's going on. I'm sorry.
That's crazy.
You see what I'm saying? That's why I want more. I love it when I see doctors on Instagram and TikTok and stuff like that that actually treat patients because they have a lot of good information. Now, do I agree with everything they say? No. But then again, some of them are plastic surgeons, some are orthopedic surgeons, some are emergency medicine doctors. They have different perspectives on patients and how they, the medications that they gave a patient. I'm a pain management doctor, anesthesiologist. I see it differently. I may utilize other drugs along with that drug to make it stronger, synergistic. You know what I'm saying? I think for longevity, those are great cells, those mu cells that I talked about that can really turn into something, can really help treating patients with a variety of different things. Now, you can't say that. Now, you can say that if I'm just talking to the patient and give them informed consent, but I'm not going to get on Instagram or anything and say, oh, this is going to help rheumatoid arthritis or this is going to help this cancer, because you can't do that. That's not fair, because I don't know. It could like help something. It could make it worse, but more than likely probably is going to happen is if it doesn't help them, you're just not going to see anything. Yeah. And people are like, I just wasted $5,000 on this. That's where informed consent comes into play. Yeah. You're taking a risk. I can't guarantee you that you're going to get better from this. And so that's what's important. I want people to really understand that, to understand, the science behind this. Most everything is experimental. There is no definite science. Now, some of them have been researched, but like BP 157, love it. Great. I use it, for little joint things and things of that nature. Guess what? If you have cancer, potential cancer, or been treated for cancer, or recently got better from cancer, shouldn't be taking BP 157. They've shown in animal studies that it can cause to proliferation of those cancers. So that's BP 157.
Exacerbates.
That's one. That's one of the most common peptides out there. And like I said, I've used it. I don't think I have cancer, but I don't know. I haven't had a PET scan or have full body MRI or anything like that. But so you have to think about that. And that's what I want more and more people to think about. You got to worry about, as you age. When you're young, like you, I remember my 30s. It was a great time. Anyway, but I'm in my 50s. And so now my mitochondria just don't work as well. Mitochondria is that's what they call it, powerhouse of the cell, right? It gets slower. That engine gets slower and slower. So I would focus on which peptides help that. MOTS-C is one of them. There's SS31, which you're like, what is SS31? Exactly. It's an experimental peptide, but it's been shown to increase mitochondrial cellular respiration. Okay. And so that's great, but once again, all experimental, but you have to think about that. Nitric oxide, that's probably the number one thing. People my age in their 50s and 60s and stuff, slowly start creeping up with high blood pressure. Slowly you get arterial blockages from platelets, from platelet aggregation. You have your plaques. Let me tell you something. I look healthy. Just got a CT calcium test. It wasn't that good. And you know what a calcium test is? It's where they take a picture on an MRI, and not an MRI, CT scan, and they can tell if you have calcifications in particular vessels. I unfortunately had them in two. Unfortunately, those ones called the widowmaker. It wasn't a horrible type of calcification, but I already have it. Yeah. So the problem with that is you either have to eventually get a stent, or you need to get a bypass of some sort if you start having a heart attack symptoms. I'm not like that. I'm very healthy right now, but this is something now. I'm almost 55. Something you got to think about. Okay? Yeah. Something you got to think about. And so for me, the two things that I think about is nitric oxide, which vasodilates. You want more nitric oxide in your body. How can I get that naturally? Well, everybody goes, L-arginine. Well, L-arginine is a precursor for nitric oxide, but guess what? It's metabolized in the liver. So you can take all the L-arginine you want, and that's an amino acid. It's really basic supplement. It's been around for decades. It doesn't, you don't get that much unless you're just taking large quantities, and you can't take that much because it can cause you pretty bad GI upset and things of that nature. It's better to take L-citrulline. Another amino acid, very common, it's been around for decades, okay? But that one bypasses the liver. And so it is also a precursor, not as much as a more close kin to that precursor, but it turns into nitric oxide and will increase your levels of nitric oxide. So that's what's, beetroot. That, these are very simple things that people can take. You don't have to take a MOTS-C, though I don't take MOTS-C, but I probably will start taking MOTS-C because MOTS-c increases my mitochondria. And in doing that, it gives me more energy to have the endurance to do more, let's say, endurance type, running and things of that nature, to give me more vasodilation in my heart so I don't develop. Just because I'm thin, that doesn't mean anything. There's plenty of skinny people have heart attacks.
Yeah.
Plenty of them. Okay. None of that shit matters. Everybody thinks, oh, it's in the guy that's big, huffing and puffing, drinking and smoking cigarettes. Yeah, they get it too. But I've seen some trainers, great physiques, look great. They have a heart attack. Yep. You're like, what? It's just either genetically it happens, or your body's more prone to it for whatever the reason, or you did something and you just didn't know. And so I had that done just because I needed to have it done.
You're higher risk because of your heart, right? Your stent in your heart.
Well, I don't have that. I have a mechanical heart valve.
Valve.
Yeah, but that doesn't cause anything like that. That has nothing to do with the potential of my vasculature supplying supplying heart blood to my heart. And so with that, I have to watch out for it. But I want people to understand that the science behind all these things, and it's great, it's up and coming, and man, I'm excited, even in the next 5 years, this kind of stuff that we're going to be able to do, especially as a physician, that I can give to my patients. Now, unfortunately, some things will be a little bit less expensive. Even stem cells have gone down in price, but the reality of it is, one, it's experimental. Two, a lot of them have some research, but it's maybe not that much human research, maybe animal studies, but even human studies may be anecdotal, may not be real, true, randomized, controlled trials. Got to think about that.
Yeah.
RCTs, randomized controlled trial, that's what everybody bases everything on. And if it hasn't a great RCT, then that's a good studied drug or supplement. And most of these things do not have that. Exosomes. Everybody talks about exosomes. I talk about exosomes. Have I used exosomes? Absolutely. You see all these med spas putting it on people's faces. You see it on, exosomes is a messenger, tells stem cells what to do. Okay. And a lot of people like exosomes more than they like stem cells. Okay. Some people take it IV. I wouldn't do that. I wouldn't give it to my patients IV because the FDA doesn't even they were like, that is so experimental. We don't even know what it does, because we don't. There's like hardly any studies done on exosomes. There are some studies, but once again, anecdotal. They're not RCTs like what we look for. So you have to be careful with that. Do I still use them? Yeah, but I tell my patients, look, this can do something or this can do nothing. But the side effects, although they're minimal, you might be the one that it has a bad side effect on. I can't guarantee that. But how I do it, on the surface, I don't mind doing that. On injecting in a joint, would I do that? Probably. But would I do it IV? Probably not. Yeah. It's not studied enough, And so you have to be very careful with stuff like that. Everything on the horizon's coming up, man, it's exciting. And I can't wait to have patients see some of those things and be treated with some of those things if they have ailments that it could help. But once again, research is not there. And so because of it, the FDA, and trust me, I don't like the FDA, but the FDA is there to provide some guarantee that this is going to be pretty much safe. And we need to have policy in place that will show that, Right. And so although I don't like them in dealing with, because I think that financially some of those things are just not right. I do think that we need, a policy from an FDA type organization to make sure that the stuff that's out there is safe. So that's why that stuff's important. I want to thank everybody for watching this episode. It was a pretty in-depth episode talking about research. Everything is based on research. You have to know what you're putting in your body. Now, some things we know what they are and what they do. Some things are more experimental, and some things just haven't been studied well enough. But they do have potentially good things to treat whatever your ailment is. So just be thoughtful for that. Think about it. Think about what you're putting in your body. Ask a lot of questions. Make sure you have informed consent. So most of the time, if it does anything, it won't be bad, but you just never know. So you have to think about that, and you have to think about the science behind it.